It's that, your face is like a sheet of paper, and every time you make an expression, you're wrinkling that sheet of paper and you're creating that crease, and that crease is getting deeper every single day, every single time you're making those expressions.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gali here. I am the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. This episode is brought to you by Edna Digital Marketing. To learn more, visit ednadigitalmarketing.com or email us at info@ednadigitalmarketing.com. Now I have Cigdem Gali and Dr. Gali here of GaliDerm. Ms. Cigdem Gali is one of the founders of GaliDerm Skincare and co-founder and practitioner of GaliDerm Aesthetics. She is a board-certified PA with her master's in medical science and a master injector specializing in women's health, aesthetics, medical weight loss, and procedural medicine. Cigdem is a local, well-established authority on aesthetics injections and an international trainer and key opinion leader for Mint PDO, Evolus, MERS, Prolinium, Mercue, and Benev. I also have Dr. Gali here, and he is an innovator and lifelong entrepreneur. He's the co-founder of GaliDerm Aesthetics, GaliDerm Skincare, Pool Night, which is a patented drowning prevention device, and a luxury real estate developer, among many other things. Welcome, both of you, and glad to have you here on the podcast.
Glad to be here.
Thanks for having us.
Great. So let's just dive right into it. Could you tell me, how did you end up getting into aesthetics?
So actually, before I went to school even, I knew this is what I wanted to do. I loved injectables. I was always very good with my hands. I loved art. I loved science, and blending it together was just the perfect fit for me. So I actually went to school with the intention of becoming an aesthetic injector. And then my husband came along.
Yeah, I mean, as Cigdem took off and grew, she's a true artist. And as an artist, she needed help on the business side. So actually, I came in later on to kind of just support her and help her, so she could kind of do her thing, and I get to deal with all the other stuff.
Yeah.
Mm-hmm. Sounds good. Well, it sounds like you really enjoyed it, this whole journey being in the aesthetic industry then.
Oh, it's been amazing, absolutely amazing. I mean, the things that she's able to do for patients is remarkable.
Mm-hmm. Now we're talking about that, would you mind discussing some of the most popular treatments that your patients come to you for, and also why do you think those are the most popular treatments?
So we offer everything. We're a full med spa here. The most popular treatments we do are PDO threads, fillers, toxins, and then we also do skin tightening treatments and facials, and a slew of other
lasers, weight loss.
Right. But I would say the most common thing that we see are the fillers, the PDO threads, and the toxins. And most recently, we've been getting a lot more skin tightening treatments with Sulfur MX and Morpheus 8. Mm-hmm. And I just see the aesthetics kind of going more towards natural results. I personally am treating patients more for the aging process rather than just filling in lines and revolumizing. I'm really wanting to tighten the skin because we're getting skin laxity as we age, revolumizing, as we age, we're getting bony loss. So I'm revolumizing those areas. And then with the PDO threads, we're able to lift the tissue, and then with devices, we're able to tighten the skin. So when you're really treating all different areas of the aging process, you're going to get a very natural looking result, which is going to leave patients looking wonderful for years to come. And hopefully we'll be able to push off facelifts and surgical treatments.
And actually, it kind of goes hand in hand, the aging process, and also with our weight loss patients. Semaglutide, we've been offering that for a very long time, but it's been an internet sensation in the last, few months. But, as patients are aging and they're losing, body fat, they're also losing structural fat in the face. So we're able to kind of revolumize and do the lifting and then the structural support that they need as the weight's coming off, so that they're looking fabulous.
Right, we have definitely seen an uptick in the semaglutide in the past, I'd say maybe 4 to 6 months. It's really become very popular. I think social media has made a huge impact on that as well.
Yeah, we've seen the same thing as well. Like lots of other practices across the country, it was something that even just probably 6, 7, 8 months ago, it was something that I've never heard of. But then in the last 3, 4 months, it seems like everyone's talking about it. I'm seeing it on the news. I'm seeing it everywhere. So as you mentioned, that's what's leading to a big rise in that popularity. Now, you did mention also something as well. You talked about the aging process, and it seems like there's a like almost an undercurrent of aesthetic practices getting or talking more about anti-aging, not just handling the aging process, but anti-aging. So is that one way that you also look at this whole process of helping your patients from an anti-aging perspective?
Absolutely. I mean, the goal really is to get patients in a little bit earlier so that we can just maintain, right? So it's like when you have a brand new car, you don't wait for 5, 6 years to get it cleaned up and change the oil. You're changing the oil from the beginning, you're keeping it clean, you're keeping it ready so it runs nicely. Same thing with the face. We're trying to keep everything beautiful, lifted, and very natural looking. So if you think of, these treatments more of like a maintenance treatment, these are the patients that look the most natural. These are the patients that age very little and they always look refreshed. So yes, absolutely, I agree with more of an anti-aging treatment rather than coming in at, patients come in sometimes and they've never had any treatments done. They're 60, 70 years old, and they're thinking, is this time? Do you think I'm ready for a treatment? And yes, they're definitely ready for a treatment, but they could have come in much sooner than that, and we could have perhaps slowed down that aging process for them.
She likes to explain to her patients that, your face is like a sheet of paper, and every time you make an expression, you're wrinkling that sheet of paper and you're creating that crease, and that crease is getting deeper every single day, every single time you're making those expressions. So, if we're with like something like a neurotoxin, if we're able to kind of stop some of those movements, you stop having those deep set creases in the face. So instead of her having to do harder work trying to reverse and fix those creases, you could actually prevent them from even happening through preventative neurotoxin treatments.
Mm-hmm. I think that's really fascinating. You brought up a very interesting point as far as this education, and in a way that's very easy to understand. So I guess, how would you approach this education process? Like, I'm sure, like you mentioned, you get people that come in and it seems like they're not quite sure, are they ready for this or not, but they were ready 20 years ago. So I guess, how do you, like, when patients come to see you, what's your approach to get them to understand, hey, like, what you're looking for, you do need this, you should have been doing this 10, 20 years ago, in a way that it's easy for them to understand, and they realize, oh wow, like I really should have been doing this before?
So my consultations are I think it's more like a conversation, right? So the patient will come in, I always like to hear what their main concerns are, and then I'll give them my opinion on, what I think is going to be best for them, to get them to a point where they look very refreshed and very natural looking, and then how to maintain that natural look. So I'll sit down with them and have a long conversation, and we'll discuss all the different treatments that I would recommend for them. And I really educate them, from A to Z on every treatment, so that they have a good understanding of, what they're headed towards.
It's very comprehensive. She takes her time with every patient. And, when you have someone that's, 25 that's coming in, it's going to be a different consultation from someone that's 65, because there's different treatment modalities they're going to require and need. And, and that's going to dictate how the consultation goes and what our recommendations are. I think what's confusing for a lot of the patients, Daniel, is that there are so many different products, so many different things, and they're like, oh, what do I choose?
Right.
And that's when the expertise comes in, and that's where her consultation comes in, and she gives a recommendation. Oh, let's use, this filler instead of that filler. We could get away with using this laser instead of doing, this thread. And you really need someone that's very well educated, very well experienced, to be able to give the patient not only the best results, but the best bang for their dollar as well, Yeah.
A lot of patients come in and they really don't know exactly what they need either. They'll come in and say, oh, I need some Botox in my lips, and Botox is a neuromodulator, it relaxes muscles. You can't put that in your lips. We need a filler there. So I will go through and kind of, educate them and explain everything to them, so they understand what treatments are going to be best for them.
And I can tell you, one syringe in our office might be equivalent to 2 or 3 syringes somewhere else, just because of technique and placement. And that's something patients really don't understand. until, I feel like maybe the more seasoned patients understand that.
For sure.
I'll tell you, our best patients are the ones that have come from other offices, because they're able to really see the difference. The patients that have never had anything done, they have no idea how lucky they are that they made it into our lobby, because unfortunately there is a lot of inexperience out there. We train for a lot of companies, and some people have it and some people don't, and unfortunately that's just the reality of the situation.
Yeah, I think you bring up a amazing point there, is that one syringe at your practice could be 2 or 3 somewhere else just because of the experience level. And I think that's one thing that a lot of people don't really understand. A lot of them just look at the price.
Right.
But as I mentioned in your introduction, is that you've been a trainer and keynote speaker for some of the top brands in the industry, and not a lot of other practices have that. I think that's a very big differentiator in your practice and with your patients. But what do you think is some other differentiators? Like as Dr. Gali, you mentioned, that's a great way of doing it, is you can get, it's less work because you have that experience, you get a better result out of it. But what do you think are maybe some other differentiators in your practice?
So being a national trainer and a KOL, we find a lot of other offices are sending us their complicated cases. Thankfully we have no complications, and if God forbid we have anything, we're more than able to fix it in-house. But these other offices, they're sending us patients from lack of experience. Cigdem just the other day dissolved a pair of lips. There was a lot of bumps and lumps. It's funny how these other providers will request that, before I touch you, we have to dissolve everything and I want a clean canvas. Whereas, we're doing more of the harder work, the heavy lifting, where we're actually able to correct the other provider's work while trying to maintain that investment that patient made.
Right. I never over dissolve anyone. If something needs to be dissolved, but I never request like a clean slate.
Honestly, so the dissolving agent is hyaluronidase. It dissolves hyaluronic acid, but we have natural occurring hyaluronic acid in our bodies. So when we're dissolving the product, we're also dissolving our own body storage of the hyaluronic acid. So it's not something that we take lightly.
Yeah, so it sounds like a lot of people don't even realize this. They think that, just reset and it's fine. But I guess it's one thing that they don't realize, it's actually hurting them to reset. But they think, there's no problem, there's no repercussions. But in reality, there is, it sounds like.
Exactly.
Yeah, and I think that's actually something that's very fascinating, is especially with practices that have such a high level of experience as you do. I'm sure you get some people that come to you and say, and maybe complain about the price of it. But I think you probably say this to them, well, would you rather go to the master or would you rather go to the student, which is all your competitors? I'm sure you get some people like that, right?
Oh yeah, we do get a lot of patients that'll ask, and I think, we've built a name for ourselves, so people kind of understand at this point as well, but we do have some patients that'll ask.
The way I like to explain it is this, you can get a polo shirt from, Saks Fifth Avenue, and you might find the same polo shirt at TJ Maxx for a quarter of the price. It's apples to apples. You're getting a savings. Maybe you're not getting the full Saks experience, but you're getting the same quality shirt. Unfortunately, in aesthetics, you're looking at a paintbrush and paint and a canvas. Is something drawn by Picasso the same as something drawn by me? No, it's not. It's two. You're really paying for the talent and the expertise, and no two patients are the same. At these trainings, we try to train them, what we do and this and that. And some some providers are asking, okay, so I inject, 0.2 mLs here and 0.2 mLs here. It's like, no, it's not a set number. You have to look at the patient. Every patient's different.
Right.
It sounds like it's a bit of an art and a science.
Yes, it really is. It goes hand in hand. Nothing is, paint by numbers. Every patient is unique. Every patient should be treated uniquely. Some patients come in and they have higher cheekbones, and you need to treat them accordingly. There's just so much variety, so you have to have that. We have a lot of providers that come in and you can see they just understand it. And then there's some providers that come in and I'm like, okay, this might take a little more time. So it's going to change from person to person, just like anything else.
Like product we're selecting, what's going on in the cheek? Did the fat pad descend? Did we lose volume in the fat pad? Do we have bone loss? Are we dealing with skin laxity? there's so many ligaments. There's so many different factors, pathology going on that you really have to assess the patient properly at your exam, and then be knowledgeable enough to understand which product I'm going to use and how am I going to use it.
Right.
Now, it sounds like you have certain cases, like you're talking about the complications, where there's a little bit more to it than meets the eye. But how would you say that, how do you balance providing that relaxing experience for your patients while also making sure that you're ensuring their safety, their well-being, their comfort level during these treatments, especially for the ones that had a complication from before?
So every patient, in terms of comfort, we have a full comfort menu that we offer for every patient. So it starts with the basics of just, like a little vibration to help distract the senses, and then ice and that sort of thing. But then we also offer Pronox, laughing gas, and other comfort measures as well.
Compounded, our lidocaine, we have a mixture of lidocaine tetracaine with phenylephrine that we numb. We inject numbing. There's a lot of measures that we do inside the office to ensure patient comfort.
And then patient safety. So with injection techniques, sometimes you have to use a sharp needle, and sometimes you have to use a cannula. A cannula is basically a needle that's not sharp on the end. And a lot of patients, I don't know if they know or not, but with fillers, there is a complication, a risk of intravascular occlusion. So in any of these areas that are higher risk, I try to use a cannula, which is a little bit safer in these zones. There's different planes that I make sure that I'm in to avoid these complicated zones. So there's a lot going on. It's not just kind of like a poke and go as you move along. There's a lot going on to ensure safety for the patient. And then we also, I'm very well equipped to manage any complication if there was to, ever be a complication, God forbid. I also manage other providers in the area, local providers that have complications. Since I train for everybody, every time I'm at a training, I try to build like a relationship with everyone. I want providers in the area to feel comfortable to reach out to me if they do have a complication. So
just today, a provider called her in between patients, asking her a question about a thread filler complication that she had, and so, it's nice being able to offer a helping hand to the community of providers and pave the way for them.
Yeah. Now, since you're basically, because of your experience, the one that people go to when they have an issue that no one else can fix, I'm sure you must have had some really challenging cases in the past. You mind sharing just one story of one particularly challenging case you had and how you were able to ultimately achieve a successful outcome for them?
So actually, yes, I had a patient that was treated by another provider in the area with PDO threads, and the provider placed the threads and they were placed too superficially. So she came to me for correction. And you can see plain as day, the thread was, coming out, and you can see the outline of the thread, and it was very painful for her as well. And she was really nervous after having gone through that to even be, get treated again. But it was actually, because I've done this so many times, I trained for PDO threads. I've been training for a while with PDO threads now. It was a quick and easy. I just numbed the area. She was, I made sure she was very comfortable. I went ahead and I didn't even remove the thread actually. I was still able to keep the thread intact. I just kind of removed the end of the thread, and then I placed a couple more threads to ensure that she had a good outcome as well. But then she's come back to me many times after that. So it was great because she was really nervous. She thought that it was not going to be, she couldn't correct it. So it was great that we were able to correct that for her, and that she's continued to come back in, get more treatments. So
something we see every day is even something small like with Botox. Patients will come in with a dropped lid or a brow, and they go back to their provider and they say, "Oh, I'm sorry, there's nothing I can do. You're gonna have to wait 3 months." But there's actually certain muscles we can, inject, manipulate, and have the, brow raised or lowered. A proper understanding of the anatomy and how every muscle works can allow you to manipulate different muscles to achieve the proper outcome.
So sometimes to help with those types of patients as well, which is really rewarding.
Yeah, so that's fantastic. I mean, it sounds like if people have no other option, you're that option, and you can fix it because of your experience. It sounds like.
Yeah, I mean, Daniel, I mean, really, we have muscles that raise, we have muscles that lower. You know, you knock one out, something else is going to happen. And sometimes, you know, we see offices and they're doing, you know, like a 3-point or 5-point or 7-point injection technique for, you know, let's say in the glabellar region for neurotoxin. And we don't do that in our office. Every patient is evaluated. We look at their movement. We ask them to frown, and it's not just to, you know, it's not like you're getting a flu shot. You know, you just go in and put in the medication. No, you have to have a very strong understanding of anatomy, and then it becomes a little artistic.
Okay, got it. No, that's fantastic. Now I want to switch tracks a little bit here. You talked about this a little bit earlier about some of the treatments that are becoming more popular, but are there any new or emerging treatments that you're particularly excited about?
I've been seeing a kind of a move or shift towards more biostimulatory treatments. You know, with the RF microneedling, Sculptra, hyperdilute radius, PDO threads, you know. Patients are looking for more natural kind of treatments and a way to help them age better, stimulate more collagen, stimulate more elastin production. And I mean, I've definitely noticed that growth.
Yeah, PRF gel has been booming in our office. If you want to kind of go into what that is.
So, I mean, I've been doing PRP for many years, which is platelet-rich plasma. And then we started doing PRF. It's probably been like 3 or 4 years now, but PRF is platelet-rich fibrin, which is, it's the same, you know, you draw the blood, you spin it down, it's just a slightly different spin, different angle. It slows, the spinning is a little bit slower, so you get more growth factors, more healing factors, more stem cells, higher ratio of all the good stuff, right? So we re-inject that into the tissue, and that helps the body stimulate collagen, and it will help the area grow. So if you take these stem cells and you place it into the hair follicles, like in the scalp, it'll stimulate those hair follicles to grow stronger, thicker, longer hair, right? If you're placing it into the dermal layers of the tissue, you're going to see that area get enhanced as well. So there's a lot to be done with the PRF. We do many different things with it, whether it's, like I said, the hair growth or just facial rejuvenation. We do, you know, the O shot, the P shot as well. So there's a lot growing towards more of that biostimulatory type of treatment, I think. And it's really exciting. I enjoy it.
And then another thing that we also do is we take those growth factors and we're able to make it into a gel-like substance. And then we're injecting that as filler. It's a natural filler.
Okay. So do you think that that's really what the future of aesthetics is going, that more natural, that path?
I do see it. I mean, I think there's always going to be a place for neuromodulators and fillers of just, you know, HAs for sure, because nothing is going to replace that instant gratification with a filler that you get. And I mean, not that I know of yet, but I don't know of any neuromodulators that are naturally occurring. So, but I do see that there is this trend toward biostimulatory treatments for sure.
Okay, great. Now, I do have one last question for you. But before I ask that, I want to point people to your website, which is www.GaliDerm.com. Now, last question is, what would you say is the most important piece of advice you can give to people who are on the fence about getting treatment done for them, who maybe want to look younger, but maybe they have some fear there, maybe it's an unfounded fear, and are hesitant to do it? What's the most important piece of advice you can give to them?
I would say make a consultation with like 2 or 3 different providers in your area. Do your research, check their reviews, you know, check out their website, see what kind of credentialing they have, and then make an appointment and see who is going to fit best with you. Because this is not a one-time relationship. This is going to be a long-term relationship. So you want to make sure that you have a good connection, and you want to make sure that this person that you're seeing has the same outlook on beauty and aging that you do. And you want to make sure that this person's very good at what they do as well. So I wouldn't hesitate. I would just make sure that, just like anything, you know, do your homework, go sit down and have a nice consultation with a couple people and see who fits best with you.
I think that to add to that also is, you know, a lot of these med spas that are popping up, they have these newer injectors, and it's a revolving door. So you're not forming a relationship with your injector. If you go to a provider-owned office, at least you know you're seeing the same provider, and you form that relationship, you form that rapport, and I think that's something very important that patients actually look for, that they don't maybe realize initially. They
realize when the injector is no longer at the office.
Right, and then they're dealing with someone else that they don't like as much or something, and then they're like, oh wait, what happened?
Right.
Another fear is fear of needles that a lot of patients have.
Right.
I can tell you, we use the smallest needles they make with a delicate hand. You don't feel anything. Between all the comfort that we give you and the techniques, it's not a painful process whatsoever.
Right.
Perfect. Well, there you have it. Cigdem Gali and Dr. Gali sharing their expertise with you all. Now, Cigdem and Dr. Gali, where can people contact you in your practice?
They can go to our website or they can call us. Our office number is 561-336-0994.
Or you can find us on Instagram or Facebook.
That's right.
At GaliDerm Aesthetics is our handle.
Okay, perfect. Well, great. And thanks for being on the show and sharing your message with the world.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.